If you, me, anyone, everyone in the world, if you take opioids for a week, let's say 2 weeks, let's just say 2 weeks. If you take opioids for 2 weeks, you will become physically dependent. 100% of people will become physically dependent. What does that mean? That means that you will, if you stop taking the drug, you will have withdrawal. Your body quickly grows accustomed and dependent on that drug, and if you take it away, you will suffer the consequences. So that's dependence. Tolerance is when you are taking your 5 milligram pill and it's working fine for 3 or 4 days, and then you're taking that pill and it's not enough. It's not enough. So then you got to go to 7. And then you take that for a few days and it's not enough. Your pain is going back up, back up. And so it's not enough. So then the doctor says, okay, let's go to 10. That's tolerance. The longer you take it, the more your body needs. And again, that's the receptors sucking in those receptors saying, oh, there's too much opioid here. You're going to overdo it. I'm taking away the receptors. Well, then the opioid that's there doesn't do anything, doesn't work enough. So that's tolerance. And that also happens, I'm not sure if that, it does happen in everyone, but it's a little more subtle. Addiction is different. So addiction is what is now called substance use disorder. That describes a pattern of behavior. And one of my pet peeves is when you hear on the news, babies born addicted to opiates. Babies cannot be born addicted because addictive behavior is a pattern of behavior, of compulsive drug taking, of taking drug even in the face of risk or serious consequences, of choosing drug over other options like food or caring for young. It's this sort of repetitive, compulsive behaviors. It's a whole complex human set of really adult behaviors. I mean, yeah, sure, teenagers can be addicted, but babies are not born addicted to drugs. They are born dependent. And so I think it seems semantic, but it's really important to understand that distinction, that people can take high doses of opioids for years and not be addicted. That is a real possibility, and it's true for millions of people. So it's really important to distinguish those. In the research, there's no evidence that opiates benefit chronic pain. In other words, it certainly is not going to cure it. It may increase your functionality, and it may make life livable, and it may make you be able to do more things with your chronic pain, which is absolutely legitimate and useful and helpful, and I'm all for it. If you have a safe regimen of opioid drugs over time that you're using to manage your pain, I really feel like that is legitimate. The problem is that everyone was just opioid. And it shouldn't be your first line of defense. It shouldn't be your second line of defense. It shouldn't even be your third line of defense. But once you've tried yoga and physical therapy, maybe a surgical intervention if it's appropriate, all the other things that might be in the toolbox, Advil, antidepressants for nerve pain and fibromyalgia, there are these other tools, but nobody's reaching into the box. They're just reaching into the opioid prescription pad for the last 10, 15 years. And that's where we are now. So we need to scale back from just handing out those bottles of pills and start tapping into the other tools, whether they're other medications and other modalities.